Heart failure in pregnancy, part 1. The hidden strain on a mother's heart. Good morning and welcome to the next few episodes where we learn about heart failure in pregnancy. Pregnancy is beautiful, but it is one of the greatest stress tests a heart will ever face. And here is what happens to the heart during pregnancy. How does pregnancy affect the heart? I'll talk about 10 things how the pregnancy affects the heart. Number 1, the blood volume increases by about 40 to 50%. More blood returns to the heart, the chambers stretch, and the workload increases. If the heart is weak, this sudden rise can trigger heart failure. Number 2, the heart rate increases by about 10 to 20 beats per minute. The heart beats faster to meet the increased demands. There is less resting time, increased oxygen needs, and more stress on the heart. Number 3 is the stroke volume. Each beat pumps more blood due to the higher preload and the stronger contractions. The total work of the heart increases significantly. Number 4, the cardiac output increases by about 30 to 50%. The heart pumps faster and more per every beat. This, in case you have diseased valves or weak muscles, they may fail to keep up. Number 5 is the blood pressure. Blood pressure drops early in pregnancy due to hormonal vasodilation. This lowers BP, especially in the first and second trimester. So women with fixed conditions like aortic stenosis can struggle when the BPs go down. Number 6, systemic vascular resistance also decreases by about 20 to 30%. Blood vessels relax, lowering the afterload. And this is good for healthy hearts, but may be risky for patients with heart failure with preserved ejection fraction. The other major thing is there is increased clotting risk in pregnancy. Pregnancy is a hypercoagulable risk, and you have higher risk of DVT and pulmonary embolism, which can cause right-sided heart failure. The diaphragm also moves up. The baby pushes the diaphragm up and breathing can become shallower, and this can worsen the breathlessness in heart failure. Number 9, you have mild heart enlargement in heart failure, which is normal physiological dilation. But if the heart is already diseased, this can worsen the remodeling. And finally, there is increased oxygen demand. Both mother and baby require more oxygen, and the heart must supply more blood to the vital organs. This already stresses a weak heart. Remember, all these changes are okay for a healthy heart. If your heart is normal, there will be no struggle. The pregnancy will continue well. But if the heart is weak, if the heart is stiff, if the heart is scarred, the valves are abnormal, the valves are tight, or the heart is previously damaged, it may struggle to keep up, leading to heart failure in pregnancy. So stay tuned for part 2, where I will discuss why does heart failure occur in pregnancy. We'll discuss from peripartum, cardiomyopathy, to preeclampsia, and hypertensive disorders of pregnancy, and even valvular heart diseases in pregnancy. Please share, like, tag someone who needs to hear these very important episodes. Heart failure in pregnancy. There is hope. With early diagnosis and proper management, mothers with heart disease can successfully carry a pregnancy to term and have a healthy baby. Dr. Muthui-Mutua, saving lives one heart at a time.